Tonight, we hear from an ER nurse on the front lines of the pandemic.
He told our Sarah Jones today this mental toll on health workers is escalating tonight.
Nurses have hit a big wall. There's been a national shortage of nurses who are leaving the workforce because of the pandemic. Really hard to take care of patients every single day when you are running about 8 or 9 nurses short.
It's a glimpse of the strain on the country's healthcare infrastructure that the experts have been warning of.
We can't move patients upstairs because we don't have any beds in the hospital due to lack of nurses. That takes more burden on the ER nurses. It's as emotionally and mentally draining for all of us.
After a year and a half on the front lines of this pandemic,
I have opportunity to pick up more hours, but I decide not to. The reason for that is I'm trying to keep myself sane. I'm trying to keep my, just from taking this over.
Most healthcare workers will agree.
I can deal with the physical part all day long. The mental aspect is the hardest thing.
And as a result, PTSD is rampant. Many are retiring early or transitioning to travel assignments where they can make at least double. But Shane says keeping active and having a wife who is also on the front lines helps him cope with the stress and trauma. Amid the fear, he still loves what he does. And even with type 2 diabetes, he still takes care of patients every day.
I'm deathly afraid of bringing this stuff home.
Shane says it's rare to see breakthrough cases.
If they do get sick, it's very mild to moderate symptoms, not moderate to severe symptoms. Most of the patients who's admitted to the hospital or who's on the ventilators, predominantly unvaccinated. My father currently lives in Burma, and the only thing they have available to them is that Sinovac is manufactured by the Chinese government. He asked me if he should take it, and I told my father that is better than nothing.
The reality is that many who end up in the ER critically ill from COVID-19 are there because they chose not to get vaccinated.
It is very disheartening and just to a point that almost sometimes makes you angry because I 100% blame this third wave on the unvaccinated.
The front line is better prepared this time around.
For a while that we were kind of reusing our N95s there because we were running shortage. Now, we were able to get N95 for basically every one of the patients that we have.
Shane is continuing to go to battle and ask that people support the front line.
Individual patient is saying that thank you for all you do, and turn around and know that they're unvaccinated. Are they really thanking me for all I'm doing? Or are they just, doing the opposite of what I'm sacrificing for?